Thank you very much, Excellency, honorable ministers, parliamentarians, ambassadors, dignitaries, members of the press, ladies and gentlemen, dear colleagues. It's a great pleasure for me to be among all these policymakers and opinion leaders of partners in population development, who by virtue of being from the South are in many ways shaping the world of today. Thanks to you all for inviting me, and special thanks for Joe Thomas, the Executive Director of PPD, whom I have known for many years now, and who has provided excellent leadership in the Asian response to HIV, and to this meeting in particular. As the Director of UNITAID, which works for access to medicines for the people, I feel privileged to be here in Bangladesh, where the movement for essential drugs and the movement for access to generics started. This is the country from where oral rehydration started and moved to other countries of the South and to countries of the North, saving millions of lives. It's also the country where NGOs started and still continue to form the core of a large-scale delivery of services for development and health since independence. The South-to-South meeting is taking place in a time when solutions to many social, scientific, technical, and health issues are emerging in the South. Let me give you some examples. Thailand has been the first country to reverse the incidence of HIV. Think of prevention interventions developed for sex workers in Kolkata have become the standard for prevention of HIV among high-risk populations all around Asia. Most trials for short-term chemotherapy of tuberculosis are taking place in South Africa and South India. Major drug trials are in the South today, and generic drugs from India have reduced the price of treating someone living with HIV from more than $10,000 to less than $100. As you know, active pharmaceutical ingredients, which are the basis of the whole pharmaceutical industry, are made in the South now. China, India, Korea, they hold the solution to the pharmaceutical industry of tomorrow. So in the past, we expected that many solutions would come from the North. Today, South has its own model, its own institutions, and proposes powerful global solutions to development challenges. So UNITAID, the organization that I chair, is based on this new reality and offers models for scaling up solutions of the global South. UNITAID is a strange organization. We work on access to pharmaceuticals for people, not by buying drugs and sending them to countries, but by transforming the markets that produce these drugs, making sure that they would be produced for the needs of the people, adapted to the needs of the people, at a price that the people can afford, in quantities and qualities that are at the need of the people in the South. And there are results which come of that, and there are impressive results. For instance, in 2006, when we started working with antiretrovirals for children, children were treated with adult pills, broken in smaller pieces, and it costed $500 per child per year. Today, there are 12 manufacturers of drugs which are completely adapted to the needs of children, formulations that correspond to what they can swallow, and it costs $120 per child per year. We have been the main funder of something called AMFM, which is the Affordable Medicines Facility for malaria, which has allowed the price of effective malaria drugs to fall from $10 a treatment to around $1 a treatment in the 6 countries in Africa which are receiving it. We invented new aspects of addressing market failures. For instance, on tuberculosis, you had countries which regularly had stockouts. They had drugs, they had the money to buy them, but they had stockouts because the drugs didn't come on time, because they did not order on time, because they didn't pay on time, etc. And what we did was just inject working capital in the system. And with WHO and the Global Drug Facility, we created revolving stockpiles of tuberculosis drugs. And now for the past year and a half, these stockouts have nearly disappeared. So we are able to change the way the markets work. We are able to help create generic markets when they did not exist. It allowed us to reduce the price of second-line antiretrovirals, dividing the price by more than 3, and saving the global fund $100 million per year. We have created something called the patent pool, which receives voluntary licenses from multinationals and then makes them available for developers of generic medicines. The famous drug called Quad, 4 drugs in 1 pill, which gives 1 pill a day treatment for people in the US, where it costs $30,000 per year, is now going to be produced by at least 2 generic manufacturers in India at a price which will be around $200 per year. So unlike traditional organizations that buy and deliver products and offer solutions of the North, UNITAID intervenes directly on the markets to create a cascade of results so that the availability of new medicines come in a short time, that the price of the drug is adapted, etc. And these are south-to-south solutions. One thing we have done recently was to create market mechanisms to get point-of-care diagnosis, the capacity to do diagnostic tests at the point where people need them, at the primary care center, even without electricity, even without laboratory technicians. And these point-of-care technologies for viral load in HIV, for early infant diagnostics, in mother-to-child transmission that you've heard of this morning, these technologies will come at a cost of less than $10 per test. Today, they are $60, $70 per test and require a big lab. We work on HIV, tuberculosis, and malaria, but our model can apply to other health problems. The United Nations Commission for Commodities for Children and Women has asked us to help them develop market-based solutions for access to commodities, for maternal mortality, for early childhood infections, for women's health and family planning. Countries can solve these issues together. They can pool demand, they can work on the markets of these commodities. We can provide the solutions, we can explore them with you and make them work. So UNITAID works in an innovative way, but we are not only new there, we're also rather innovative in the way we are financed, because an organization that works on markets has to put money inside the markets to see the results. And so we are financed through what is called mostly innovative financing. Innovative financing is a collection of small and painless contributions from the activities that have the most benefited from globalization, and also are the ones which least contribute to global solidarity. So this is air transport, this is trade, this is communications, this is financial transactions. UNITAID has been financed mostly by an air ticket levy, which has been set up by 9 countries, 6 of them in Africa. UNITAID is financed in a large way by African countries, but also in Chile, in France, in South Korea, etc. We have seen that these contributions are extra budgetary resources that support UNITAID, but also that support programs in the countries themselves. Cameroon, which has set an air ticket levy, gives half of it to UNITAID, gives half of it to the program of support for HIV patients. In Korea, we receive half of the air ticket tax of Korea, the other half goes to the NGOs working on global hunger issues. So these are new mechanisms for funding which have come up, which have allowed UNITAID to receive funding in a way which is predictable and through a multi-year approach. Interestingly, the air industry has not known a real crisis, and the number of people taking the plane has not changed much. Now we are looking a lot at promoting what is called the financial transaction tax. Now, financial transaction tax is an innovative financing mechanism which may be interesting for any country in which financial transactions occur. We have simulated with economists and financial experts what a 0.01% tax on shares transaction, 0.01% tax on derivatives and futures transaction would bring, and it would be nearly $80 billion in the OECD countries. It would be nearly $2 billion in South Africa. So this is a possibility that countries in the South have to raise new monies to address the issues of tomorrow. And financial transaction tax is something that the banks and the financial people say is absolutely impossible. But of course, they disregard the fact that 41 countries already have such a tax, that the largest of such a tax is in the United Kingdom, where the city is, with the famous stamp tax on all shares transactions. And it has now been adopted by France, it will be by Germany before the end of the year, and 11 other European countries next year. So all these are mechanisms that offer solution for the South and that are based on very small contributions on large numbers of transactions. As leaders of the South, we need your advocacy to shape initiatives and institutional mechanisms to create such initiatives and raise new resources for yourselves, for the development mechanisms that can help you, such as UNITAID. And today, such coalitions are necessary, and this is why we are so eager to have this association with PPD, and we are going to have a partnership and a developing agreement framework to work together. Now, it's clear that there are still hurdles to be crossed and barriers to be leveled, challenges to be met. When is it not the case? But we know